The clinical diagnosis of Huntington disease involves analyzing DNA for a specific mutation, an excessive sequence of CAG repeats on chromosome 4. But while scientists examine the genetic markers, people living with HD have to manage the everyday physical reality of a progressive movement and cognitive disorder. Over the next 6 minutes, we are going to translate that complex neurological science into a practical, actionable daily movement routine. Step 1 is preparing your physical space. Before starting any movement routine, you must clear the room of all trip hazards, set up a physical memory aid like a whiteboard, and put on supportive footwear. Securing this safe, predictable environment provides the required foundation to take control of daily symptom management. Now that we have a safe space, we have to adjust how we approach time. Everyday tasks must now be allocated double their normal time to accommodate the motor and cognitive changes of HD. Along with extra time, you need memory aids. Write your daily tasks out clearly on that whiteboard we set up earlier. People with HD often experience forgetfulness, but they do not have classical amnesia. This means visual schedules are highly effective at keeping the day on track. When moving through that schedule, the most critical failure point for mobility is dual tasking, trying to walk and talk at the same time. Neurologically, tasks like walking used to be relatively automatic. In HD, those same tasks require intense conscious attention and drain your cognitive resources. Doing two things at once drastically increases the risk of a fall, so we practice strict single tasking. If you are walking down a hallway and someone asks you a question, stop completely. Finish your physical movement, answer the question, and only then resume walking. Forcing this single tasking approach reduces cognitive overload and keeps you safely on your feet. With the environment and mindset established, we can build your active physical therapy checklist. We recommend selecting 3 to 4 specific goals from this list to focus on each day. This checklist graphic divides standard HUD physiotherapy into 6 core pillars. The first priority is gait and balance retraining to maintain stable walking patterns. Next is fall prevention, which focuses heavily on the mechanics of safely transitioning from sitting to standing. The third area covers muscle strengthening and aerobic capacity, often utilizing light resistance to keep muscles engaged. Fourth is task-specific manipulation. This means practicing highly focused everyday actions, like carefully reaching for and grasping a household cup. Finally, we have respiratory function, like deep breathing exercises, and wheelchair prescription and training, which support mobility in the advanced stages of the disease. Pulling 3 to 4 items from this tailored checklist each day transforms a vague instruction to get some exercise into a targeted, measurable defense against neurological decline. Even with a clear checklist, a common point of frustration is actually starting the routine. It is important to know that a lack of initiation is a documented neurological symptom of HD. It is an effect of the disease, not laziness or a lack of desire to participate. The solution relies on caregivers. Using enthusiastic, clear initiation prompts helps the person with HD begin a task they will enjoy and benefit from. Once you are consistently starting the routine, you need to track your progress. The Timed Up and Go test, or TUG, is a reliable weekly standard for measuring mobility. This floor plan shows the exact setup for the TUG test at home. You need a sturdy chair, a clear measured 3-meter or 10-foot straight path, and a visible turnaround marker on the floor. To run the test, start a timer. Stand up from the chair, walk at a normal pace to the mark, turn around, walk back, and sit down. Stop the timer as soon as you are seated. Logging this time every week provides hard evidence of how your daily routine is working. You can also discuss alternative outcome measures, like the Berg Balance Scale or the Tinetti Mobility Test with a physical therapist. Tracking these outcomes regularly provides objective, manageable data to help you navigate the subjective feelings of physical decline. This visual blueprint summarizes the 4 pillars of our completed routine: an adapted, safe environment, a targeted daily PT checklist, a clear strategy for initiating tasks, and a weekly tracking method to measure progress. When fighting the progression of HD, daily consistency yields far better results than occasional, intense workouts. To put this into practice today, download the blank HD Daily Movement Checklist linked in the description below and schedule your first focused session. Structuring your daily actions gives you a reliable system, turning an overwhelming diagnosis into a clear series of controllable, positive steps.